Morning. My name is Dr. Dawal Mistry. I am a bariatric and laparoscopic gastrointestinal surgeon based in Nairobi for last 5 years. I'm having experience of more than 10 years in the field of surgery. I've been trained in India for my basic general surgery, and then I've attained my training in laparoscopic bariatric surgery from France. Bariatric surgeries are weight loss surgeries. They are minimal invasive surgeries where keyhole incisions are kept around 4 or 5 incisions. With that, we alter the anatomy of your stomach and intestine, which helps you reduce the weight. It also helps you reduce weight related comorbidities like depression, obstructive sleep apnea. It reduces diabetes, it reduces cancer risk, and it also prolongs your life expectancy. We measure the weight in terms of body mass index, which is your weight in kilogram divided by your height in meter square. So our normal range of BMI is anywhere between 18.5 to 25. Once you are above 25, you are overweight, and once you cross 30, you are obese. So usually obese patients with all these comorbidities like obstructive sleep apnea, diabetes, hypertension, arthritis, depression, they are the candidate for the bariatric surgery. And if you are super obese without any comorbidities, then also you are a candidate for a bariatric surgery. Now, bariatric surgery are restrictive and malabsorptive. So, in simple language, sleeve gastrectomy, where we reduce the size of your stomach, is the first and foremost surgery, which gives you weight loss for about 20 to 30%. And there are gastric bypass, where we not only make your stomach smaller, we also bypass a segment of your intestines. So it leads to more weight loss. You can expect around 30 to 40% of weight loss with this surgery. So one thing is it reduces size of your stomach. We also bypass a segment of intestine, so the food is absorbed less. But not only the size of the stomach and the bypassed intestine helps, but also it creates hormonal changes in your body. These bariatric surgeries reduce the hunger hormone, which is ghrelin. So your hunger goes down because of these hormonal changes. And also it increases a hormone called GLP-1, which improves your insulin resistance. So not only the reduction of size and bypass intestine, with hormonal changes also, you reduce your weight. These surgeries are minimal invasive, so the risk are usually less. You can expect to have less than 2% of risk with these surgeries. However, with any surgery, we have some risk. So some potential risks are leak from the stomach and intestine, which we alter, but they are less than 2%, so there is nothing to fear about it. So in terms of recovery, hospitalization is 2 days after surgery, but we expect you to walk by yourself from the evening of the surgery. You can resume water and other food from the next day of the surgery. The inner healing keeps going on for about 3 weeks, but we expect you to be on your normal activity within 1 or 2 days. Yes, of course, we need to have some dietary changes as well. First, foremost, you need to stop alcohol. Alcohol is not allowed. Also, in terms of diet, you need to take a high protein and low fat diet, and you need to avoid sodas and liquid calories. Weight loss depends upon what procedure we are doing. With sleeve gastrectomy, you can expect to lose around 20 to 30% of your weight. With gastric bypass, you can expect to lose around 30 to 40% of your weight. Yes, supplements are required because you're not taking enough calories. You might develop some vitamin deficiencies. So we usually prescribe those supplements for up to 1 year for sleeve gastrectomy and for up to 2 years for gastric bypass. Sleeve gastrectomy is an irreversible surgery, but stomach is a stretchable organ, so it can stretch back with time, but not up to normal. Gastric bypass is a reversible surgery, so yes, if you lose too much of weight or if you enter into malnutrition, we can reverse this surgery, so it is safe as well.